Welcome back, everyone. We had a patient in the office here this morning, and while she was getting her adjustment, her husband was there as well, and he mentioned to me how he was told he could never see a chiropractor because he had had some spinal surgeries done a couple years before. It turns out that he had had a really bad intervertebral disc herniation from an injury he'd had 20 years before that. The injury was left untreated. He needed to have part of that intervertebral disc removed, and even a couple of his vertebrae were fused together because of the instability in the area. With patients who've had spinal surgeries, whether it's intervertebral disc dissections or if there's fusion done, they actually still need a chiropractor. In fact, they often need a chiropractor more than someone who hasn't had a surgery before, because there are still some mechanical defects that are there above or below the surgical site that could cause more deterioration, more degeneration in the spine, and the more likelihood that they'll need additional surgeries down the road. Now, clearly, the chiropractor has to know what kind of surgery was completed, and if there are fusions there or limitations, there are just certain techniques that should never be done on a patient when they're getting adjusted. But there are also techniques that work really, really well above and below the surgical site to make sure that patients still get the most out of the spine that they have. I'm out of time. If you have any questions about spinal surgery as it pertains to chiropractic care, I'd be happy to answer any questions you have. As always, thanks for all the Facebook and online love, and we'll look forward to talking to you next time.